It's Alexis. So this video, I just wanted to talk about more in depth about depression and anxiety because those are things that I know more about and that I deal with. So I wanted to basically go into the symptoms and the side effects. So first off, if this video or content does not interest you, please do not watch it. It's just courtesy and I don't want any negative comments or rude, nothing rude basically. So depression. Imagine, like remember in the movie Frozen, how Olaf at the end he has like a cloud over his head to like keep him like alive or whatever. But imagine like having a cloud over your head all the time, like a hazy, foggy cloud. But it's hard to understand for other people, but it just feels like there's a dark cloud over your head all the time and it's hard for it to go away. It sits in your head and consumes you. So that's how it basically is. It's just like a dark cloud over your head all the time. It causes you to have dark thoughts. You feel tired, unmotivated, confused. You feel empty, hopeless. Everything is foggy, unclear. You don't want to do anything, so that is the unmotivation. And there's also like different levels of depression, and it can come and go. So just because someone says they're feeling okay today, that doesn't mean they're not going to feel down the next day. You never really know with depression. It's kind of weird, I guess. So I guess I can more explain, like, if you don't really understand it, try to imagine when something really bad happened to you and how you felt. But imagine feeling like that for more than a month, and maybe even 6 months, a year, more than a year. Just that really bad feeling, like super down. It's not just sadness, it's more than sadness. So let me just go to my notes. I wrote down a little bit of notes. So depression is not just sadness. It is a weight that keeps you in bed. You don't want to get out of bed. You feel unmotivated to do absolutely anything. You don't want to get out of the house. You don't want to associate with people. You isolate yourself. It can be unexplainable and leaves us silent. But sadness is a feeling you can handle. It goes away eventually. But depression is hard to just get over it. You can feel so empty inside. It keeps you stuck, and it's hard to get out of the mindset of feeling so down. So sadness is easy to talk about. You can say with your friends you're sad over a boyfriend or because you failed a test or just something like that. But with depression, it's hard to explain and it's hard to talk about for most people. And it isolates you. You don't want to hang out with your friends. You don't want to hang out with your family. You don't want to go out. And you feel like no one gets you. But if your friend does try to talk to you about how they're feeling depressed, don't say, "Oh, I get it. I've been there. I've been sad too." But depression is not just feeling sad. It's more than that. It can affect you, and it basically can affect all of your life. It can affect your work life, your school life, your relationships, anything that has to do with your life, it can affect it. Sorry, I'm just looking at my notes because I don't remember everything that's off of my head. Well, so depression is not just a feeling. It's not just, "Oh, I'm feeling depressed," or, "Oh, my boyfriend broke up with me, I'm feeling really depressed." We have to be careful throwing around that "I'm feeling depressed" because it's more than just having a breakup or failing a test or losing a job. I mean, from those things, you can fall into a deep depression. But we have to be careful with saying, "Oh, I feel depressed. Today is just not my day," or, "Oh, that test was so depressing," or "That movie was so depressing." You just have to be really careful about that, I think. because depression is a very serious illness. And we need to stop glamorizing it as well, because it's not something that's romantic or great to have or a wonderful thing. It's not at all. Like, it's just, I wish we would understand that it's more serious than that. So I think we should all just take it very serious, because it is a serious medical condition. It's not just a feeling. It's just like having asthma or having diabetes. It's just an illness that some people happen to have. Also, it could be genetic, but not all the time it is genetic. Sometimes people just get depression. There's no main cause for it. It could be caused by some events that happen to you in your life, but not all the time. It could be caused maybe like a death in the family, or a bad breakup, a loss of a job, or sexual abuse. Anything that's serious happened in your life, you could get depressed over. But sometimes there's not always a reason. There's not just always a reason to why you're feeling the way you do. And I think we should just try to accept that. So basically, some of the symptoms that people can have when they're depressed are just having a depressed mood, no interest or pleasure in the things that they usually like to do, losing weight or gaining weight, inability to sleep or oversleeping, pacing or wringing one's hands, or overall slowness of thought. So basically, like racing thoughts, or not able to concentrate, feeling very tired, low concentration, and recurrent thoughts of death or suicide. So usually if someone has 5 out of 9 of those, they could be diagnosed as having depression. And I would suggest, if you ever feel these for more than a month, then try to contact your doctor or therapist to help you, because it's better to get help than to just not get help and be in that state of depression. Because usually a lot of people don't get help, and they don't get help for more than, like, the average person doesn't get help for 10 years. So it's important to just, if you feel these feelings, don't brush them off, because they could be serious. And usually the other symptoms could be, it must cause significant distress of your daily life, and they can't be substance related and not better explained by another disorder. And usually the treatment for depression could be non-pharmacologic. So basically that could include physical activities, exercising 3 to 4 times a week, changing your diet, eating more healthy, or talk therapy, which includes having a one-on-one therapist or going to group therapy. Or you could go to the medical route and take antidepressants or something that could help your depression. And usually these things are effective with 50% of the patients. And you shouldn't be ashamed of admitting that you have depression, because it's honestly not very rare. 1 out of 5 Americans have depression. A lot of people deal with depression at least once in their life, or some mental illness once in their life. It's not as rare as you think. It's okay to not be okay. And just, if you know someone who has depression, be as supportive as you can, because they're going through a lot, and it's hard for them to actually admit that they have a mental illness. And also remember that there are just the depression is just telling them all these lies, like no one likes you, or no one cares, no one loves you, who cares if you're gone, or you would be better like not here in this world, and it makes you feel like a burden to everyone. So just, if you know someone who's dealing with something, just try your best to be there for them, because you never know how much a little thing could help them. Also, the next thing I want to talk about is anxiety. Anxiety sometimes goes hand in hand with depression. So with anxiety, some of the symptoms are excessive anxiety present more days than not. It's hard to control. impairment in daily life. So if you miss deadlines or just you feel very, very nervous, like you can't control it, it's not related, it can't be related to a medication or drug abuse. It shouldn't be explained by another mental disorder. So yeah, those are the main symptoms. Basically, anxiety is like an overall worry and nervousness. It's not always caused by a certain event, but it always feels like it's there. So some people are nervous even about going out of the house. They have a lot of social anxiety where they don't even want to go out. They don't want to see people. It's hard for them to do everyday things. The thought of getting through the day even gives them so much anxiety that it's hard to just do it. It's hard to go through the day and the emotions. Contributions to anxiety could be money, family, work, relationships, and school, but this can all affect, like, anxiety can have effect on all of these relationships. And remember that having anxiety, you feel like it's out of your control and you don't know how to stop it. So it's not just like, oh, I'm nervous about seeing these people. It's like it makes you think over and overthinking and racing thoughts all the time, or things like, oh, that person's not going to like me, or what if I get in a car crash today, I don't want to drive, or what if I get fired today, or how is my dad doing, how is my parents doing, how is my sister doing, like overthinking and worrying constantly. So you could feel restlessness, edginess, difficulty concentrating as well. Your mind could go blank, you have irritability. There can also be physical symptoms that have to do with like digestive systems, digestive problems like eating more, eating less. You might have muscle aches and soreness from tension in your muscles from being so tense all the time. You could have difficulty sleeping because of racing thoughts. You'll have a hard time sleeping or even oversleeping. And you'll be really tired, obviously, from not really sleeping as much as you need to. So the same kind of treatments with anxiety could be used for depression, which is like going to therapy, and either group therapy or one-on-one with a therapist or medication. So I just want to get these symptoms out there and try to get people more to understand that depression and anxiety are serious mental illnesses. They shouldn't be taken lightly. And if you're feeling any of these symptoms, I would suggest to talk to a friend, talk to a family member, and just try to talk about how you're feeling. And then maybe if you feel up to it, get help. I know it's like one of the hardest things to do, to just actually admit that you're going through something, you have a mental illness, but it's really important to get help because it can help you in so many ways. So I hope this helped everyone to try to understand anxiety and depression. I know it could be hard for people to understand if they don't get it, and if you're thinking you might have one of these, I hope I helped you try to understand it better. And I will provide resources in the link in the description. I'll provide some links. So thank you for watching, and I hope you have a great day. Stay positive, and you can always message me if you need advice or just want to talk. Thank you.